And good evening, everyone, and welcome to the Ask Dr. MJ. Why? Because your health is important. Facebook Live, Instagram Live, YouTube Live, the only interactive healthcare forum that allows you to listen to call in and ask your healthcare questions. So we are live here in the studios here at Atlanta West Primary Care, and we are so glad to have you here with us. Now, we got a couple of things to talk about this evening. One is hot, and it's about to get hotter. So I spent the last few days in Chicago at the National Medical Association Annual Scientific Assembly, where we had doctors from all over the world, not just in the United States, attending and presenting. I was fortunate enough to be one of those presenters, and I spoke on a couple of topics. But one of the things that got my interest was the talk on climate change and how it has a negative impact on the body. And so we found out that the key temperature is 75 degrees. And so if the temperature during the daytime exceeds that, which it often does, that's not a real problem, as long as the temperature at night goes to 75 degrees or less. When that happens, your body can reset, the environment can reset, the heat that's been collecting in the trees and in the concrete can dissipate, and the humidity can normalize. When that does not happen, when the temperature remains above 75, then bad things happen. Your body cannot reset. So you start off the next day in a heat deficit. And that means you're highly susceptible to the effects of heat. What you may not know is the biggest weather phenomenon and the most deadly. It's not hurricanes. It's not tornadoes. It's not flooding. The thing that kills more people every year is heat. So when the heat creates that problem, you will have that problem. And in the news today, they're talking about there's going to be like a heat dome over most of the United States that won't dissipate for a week, possibly two, and it's going to cause some major problems. And so the question was, do you what they call pre-cool your home, keep your air conditioning on? Before, they used to tell you to cut it off and then try to cool your home back off. But if your home absorbs that heat and holds that heat, it's more energy to try to cool it back down than it is to keep it cool from the beginning. So this is going to be a major strain on our pocketbooks because of the cost of the energy when you're using your air conditioner 24/7. It's going to put a major strain on the environment. It's going to put a major strain on the power grid. We're probably going to have some blackouts, brownouts across the country as people are trying to stay cool, and it's just very difficult to do. So simple things, if you cannot get your home cool enough, a cool shower, a cool bath will help temperature. You can soak in the tub. That is very good for cooling you off. Or like I said, take a long shower, not a hot shower. A lot of women in particular like to take hot showers. You don't want to be one of those in this weather. You want to take a cool shower. The water doesn't have to be cold, but a cool shower. But if you're overheated or feel overheated or have been taxed by heat burden, then a cold shower will be just exactly what you need so that you can cool off your body and your core temperature. Because if you just cool the skin off, then you're going to have a rebound where your core temperature flares up, and you're going to be doing more than that. So that is a problem. That is where we want to be and how we want to do it. We want to make sure that you're keeping yourself cool. So stay hydrated, 8 to 10 glasses of water daily, not counting anything else that you drink. There's no substitute for water. So you want to make sure that that's what you're drinking. There are places and things that, people drink coffee, people drink tea, sodas, these high sugar fructose drinks. And then even the things like Gatorade and Powerade. Gatorade has 44 teaspoons of sugar per bottle. That is far too much, and far why a lot of people choose other alternatives when they're trying to rehydrate. Amazing enough, one of the best rehydrants is beer. Amstel Light beer is the best. Drinking it when you're dehydrated will not make you drunk, high, or happy, but it will give you all the benefits of rehydration and cooling you off if it's ice cold. So take that advice, do those things, and stay cool during this pending heat process. Okay, Holly, let's call it out. Let's see who we got. Okay, Linda Bloomer from Birmingham, Alabama. Thank you so much, Linda, for joining us. We appreciate you. You're a returner. Lynn F., hello from hot, humid St. Louis. Just the topic that we're talking about. I did have the pleasure of visiting St. Louis a few weekends ago, and it was great. Carlos Ward, this is Carlos from Douglasville. Hey, Carlos, thank you so much. We appreciate you. Val D, good evening, and everyone from Jacksonville, Florida. Thank you, Val. We appreciate you as well. Kayshawn Garman, hello from Atlanta, Georgia. Thank you, Kayshawn. I love that picture of you in full uniform. Hoorah, Devil Dog. Tawanda Smith, hi, Dr. Collier. Hello, Tawanda, how are you? Okay. Etricia Reese, good evening. Etricia, Austell, Georgia. Miss Reese, thank you so much for joining us. Sean Big Time Green, White from Monroe, Louisiana. Sean, stay cool down there, man. It's going to be hot in Louisiana. Glenda Everett, good evening from Warner Roberts. Hi, Glenda. Thank you for joining us. Willeen Atkins, hello, Dr. Collier, and everyone from Brooksville, Florida. Hi, Willeen. How you doing? Miss Makiba Boland, thank you so much for joining us. One of my favorite friends and patients. We appreciate you always being here. Derek Griffith, hey, Derek, thank you so much for participating. Chicago in the house. Thank you so much, Derek. We appreciate you. Okay, Kelly Harris, hi, Kelly. We appreciate that hand. Good to see you. All right. Shanta Russell, Chi-Town here, Chicago. Just left Chicago, and it was great. Amazingly enough, it was going to get hot today, which is the day that I left early. So I'm missing out on this heat wave that's there right now. So again, but it's not just in Chicago, it's around the country. Please be careful, please be safe. All right, Miss Brown Lynch from San Francisco, Sheila Alexander, good evening. Sean Big Time, once again, good evening. All right, this is the People Show. The questions that you have are what's most important. So we're here to answer your healthcare questions. So let's get to it. Kelly Harris, Dr. Collier, my partner, is 55 and has ED issues. He has tried everything, pills, pumps, doctors. Nothing has been effective. Could it be from circulation of varicose vein, hernia, blood pressure, cholesterol? Kelly, all of those things. First, he needs a comprehensive physical examination to evaluate his blood pressure, to evaluate his cholesterol levels, to evaluate whether he's diabetic or not. And if he has any of those disease processes, those need to be treated and corrected. That will give him his best chance of doing that. I hope that someone has actually tested his testosterone level to see if that is the case. If he has not had any history of any trauma to the groin, i.e. kneed in the groin, kicked in the groin, fell off of a bicycle and smashed his groin and testicles, and those are things that are unusual. I like to talk about things that are affecting regular people. So I'm assuming that none of that has happened and that he's just having a problem with ED. Part of the biggest health, the biggest sex organ is the brain. So the problem with ED is once it has happened, a man becomes so focused on please don't let it happen, please don't let it happen, that he can have a fully functional erection, but think himself or talk himself out of it because he's so worried about whether he's going to be able to maintain it. So thank you for being a patient partner with him. I hear you when you got the pills and the pumps. You do not mention the direct injections. There are injections that go directly into the penis that give you an erection that can last 4 to 6 hours. So also one of the things, but the problem and the point here is that he has been probably not thoroughly evaluated, but more importantly, regardless of the level of his evaluation, he has not had symptomatic improvement. And it is very important that he have a provider that partners with him to get to the bottom of this. And it may be, he may need a special ultrasound of the penis that will determine the blood flow there. My Lipo T product is excellent from that perspective. It helps your body build testosterone naturally. It is perfectly compatible with any disease state or any other prescription medication that you may be on. Go to the website, lipodrops.com right now and get the Lipo T and see. Now, this is not like Viagra or Cialis. You don't take a pill and then 20 minutes later you have a firm hard erection. That is not how it works. What it does do after you've been taking it for a couple of weeks, it changes your hormonal status in your body and improves your erectile function naturally. After you've been on it for a month, then you're really going to have some great benefit. And so I tell people, don't expect major changes until you've been on it for at least a couple of weeks. Then you should start to notice improvement. After you've been on it for the second month, you should really be where you want to be. And by the time you finish a quarter, 3 months, 90 days, you will have optimal benefit from it. If you can benefit from it, you will have optimum benefit from it. So Lipo T for testosterone, it is a testosterone booster. It is a natural testosterone booster that makes your body make more testosterone spontaneously and naturally. All right, Kelly Harris, all has been tested. Maybe mental injection has been done to scare him. I purchased your pills for him. Okay, so if you have the pills, he needs to take them. The option is to take 2 or 3. You can take 3 every day, anytime after dinner and at bedtime. Or I'm sorry, anytime after dinner up to bedtime. So it doesn't matter what time, but just try to create a routine so that he can take them at roughly the same time every day. Big glass of water when you take them so you can dissolve the tablets, get them out of your stomach and into your system. And he has to have faith. He has to have faith that this is going to work because, like I said, you can outthink yourself or talk yourself out of a great sexual experience and a great sexual response by overthinking it, so to speak. All right, great question, Kelly. We appreciate you. Keep us informed. Shante Russell, good evening. I have digestive issues age 50. Even eating the right foods, it seems like I'm bloated from everything I eat. I have hypothyroidism too and RA, which is rheumatoid arthritis. Any suggestions? One, you need food allergy testing, Shanta. There's a single drop blood test that you can get at any doctor's office now. They can send it to virtually any lab. All labs are doing this now. The most common labs, of course, are Quest and LabCorp, but there are other labs that can do it as well. Just go to, when you at your doctor's office, tell them you would like to get blood allergy testing. Now, it's going to come back and show you, because you described elegantly exactly the symptoms that you have when you have food allergies. You have that bloated feeling, nothing feels to go down and or digest appropriately. So you have that problem. Now, how are you going to treat this once you get the information back? You don't have to wait for the testing. You can improve your GI function immediately by starting to take probiotics. Lipobiotic is an excellent product. You take 2 capsules a day. I take 1 in the morning when I brush my teeth, 1 in the evening when I brush my teeth. Take that for a couple of weeks and your life will be changed, because no matter what food allergies you have, they will improve. But also any other allergic symptom, sinusitis, allergic rhinitis, that's the runny nose, itchy eyes, itchy skin, such as eczema, asthma symptoms. All of these things greatly benefit from the use of probiotics. Now, this is not a use for a while and stop. Based on what you're describing, you are sensitized, and that means you're going to need to take probiotics. Yes, they need to be a regular part of your life. Now, there are other ways to get probiotics. You don't have to get my lipobiotic product. I highly recommend that you do, because it's exactly what you need, and it's portable. The other natural way is eating Greek-style yogurt on a daily basis. So there are any brand that's Greek-style that has the highest concentration of the good bacteria or probiotics in it, and some contain prebiotics as well. The Activia brand is an excellent product that you can get. Activia is in the green cup. Any flavor, doesn't matter, whichever one you like. Just make that a part of your regular routine. Most grocery stores have yogurt on sale every week. Buy 10 for 10. So it's a $10 investment for 5 days of eating. That's your breakfast. You know, before you depart for work, I always have a cup of yogurt. And so that's one of the things, because like most people, you know, I've had food allergies, eczema, problems like that in my life. But once I started taking the probiotics and eating the yogurt, life has changed. Skin is perfectly clear. Children have severe eczema. All of them clear now from eating the yogurt, taking the probiotics, and again, digestive issues. Now, normal bowel movements, regular bowel movements, no bloating, no distended abdomen, no foul passing of gas, all of those things. So the Lipobiotic is the product for you that would be perfect for you. Go to the website, lipodrops.com, or you don't have to do either. You can do both. I do both. I eat yogurt regularly, and I take the probiotics as well. That will be life-changing for you. It will also help with your thyroid disease, which is usually has an allergic component and antibodies to the thyroid. And rheumatoid arthritis is an autoimmune disease as well that will benefit from calming down the allergy response and calming down your immune system by taking the probiotics. You will note benefit from your rheumatoid arthritis as well. Okay, great question, Shanta. Shanita, that's how you say that. Can you remember low-carb meals can you recommend low-carb meals for diabetics? There are several low-carb meals. The menu does not have to be that specific. Low-carb meals is just what it is, just what it sounds like. But many, just Google low-carb meals for diabetics, and you will get menus, if you will, that will give you that. Dr. Kaya's recommendation for diet is very simple. If it swims, you can eat it. If it flies, you can eat it. That means more chicken and fish, baked or broiled, not fried. Your preferred method of food preparation is baking or broiling. And if it walks on the earth with cloven hooves, that's red meat and pork, you need to limit those things in your diet. Eat more fatty fish. The omega-3 fish oil and fish products are amazing as far as your general overall health are concerned. But instead of giving people menus and things they have to remember and have them reading labels and all of that, the simple solution, once again, say it with me loudly. If it swims, you can eat it. If it flies, you can eat it. If it walks on the earth with cloven hooves, you need to limit or avoid it. And the only food that is a caveat is duck. Ducks fly. They are the highest fat food. That is why ducks float on water. Oil floats on water and ducks can float. So no ducks, no fried duck, Peking duck, none of those things. The highest fat foods you can get. But so that's a carb. So if you want to avoid that. But again, there are low carb diets that include lean meats. And so those are things that you can take into consideration. But again, specific menus, most people only follow them for a short period of time because either they're giving you the same foods over and over and people get tired of that, or it's just too difficult to prepare those foods. So what you do, you just don't do it. But if you keep in the back of your mind, every time you're sitting down to eat, when you're eating at home, when you're eating at a restaurant, the next time you're at Applebee's or you're at Longhorns or you're at a 5-star restaurant, you think to yourself, if it swims, you can eat it. If it flies, you can eat it. And my preferred method of food preparation is baked or broiled, not fried. There we go. Okay. Thank you, Cheryl. Carlos Ward, what causes phimosis and do you have any recommendations for treatment? Phimosis is a condition that occurs in uncircumcised men where they cannot pull their foreskin back over the head of the penis. The head of the penis is therefore trapped and everything that's under the head of the penis. So it becomes a personal hygiene matter. Oftentimes, a gentleman then is susceptible to skin infections and or yeast infections, just like a woman, because moisture gets under that skin. They cannot pull it back to clean it or wipe it away. And it ends up with an infection and inflammation of the head of the penis. This can also get inside the urethra, the urinary tube, and cause problems there too. So, hate to tell you, Carlos, but the official treatment is adult circumcision, which sounds much worse than it is. But they cut off the excess skin. It becomes a better cosmetic look in most people's minds, but without question, regardless of how you think it looks, it's going to be healthier, and you will not be carrying bacteria and yeast under that foreskin that you can transmit to a partner. So, the healing period is short. It is not disabling, but it is a process. Again, they call it adult circumcision. It is an outpatient procedure. You go in the morning, you home at lunchtime, and you basically take a couple of days to heal, and then you're fine. And that for the rest of your life, this will not be an issue. So I highly recommend that if you have been diagnosed with phimosis, that's the real treatment. Anything else is putting creams and gels and ointments underneath that foreskin with a Q-tip, treating it, then it will recur. As soon as you stop using it and treating it, if you have yeast, you can take an oral medication, diflucan, the same diflucan that women take for vaginal yeast, men can take. There are a couple of others. Terbinafine is also good. You can take those, and they will help control yeast. They will not help control infection. And if you're having intercourse and it's pushing that skin back, the skin cracks and tears, and one is sore. Two, you get infections under the skin, which can turn bad very quickly. So surgical repair and removal of the foreskin will fix this problem. You need to see your friendly neighborhood urologist, and just Google urologist near me, urologist in my area. You probably can get in without a referral from a primary care with that diagnosis. So just call them and say, I have phimosis and I need to have it surgically repaired. Thank you, Carlos. That's a great question. Tawanda Smith, how long can I stay on HRT? I've been on for several years, closely monitor my blood work. It's life-changing in a good way. HRT, hormone replacement therapy. Dr. Collier is a big proponent of HRT. There's literally no reason to ever come off of it. It is the fountain of youth. It makes you younger. You feel younger. You look younger. You are younger on a cellular basis. For women, it enhances the thickness of the vagina so that it is thick and strong. It makes the vagina moist and wet so that you can enjoy intercourse. and enhances the intensity of your orgasms in a way that nothing else can do. But other benefits, it helps you sleep better. It helps keep your weight down. It increases your muscle mass and decreases your body fat. HRT, or hormone replacement therapy, is God's gift and the greatest thing that's ever been invented. It has been around, pardon me, from the 1960s. We just didn't know about it. It was available in places for the beautiful people like Palm Beach, California, and West Palm Beach, Florida. And then, so if you know anybody back then, particularly actors, actresses, and athletes who were aware of this technology, they were getting it and using it and looking good, and everybody thought it was just they were blessed and it was good genes. No, it was bioidentical hormone replacement therapy, or BHRT, that did it. Now, with the internet comes along, people find out about these things. The first time I was introduced to it was actually by a patient. Patient came in looking amazing, had lost weight. More importantly, their attitude and emotional status was good. I said, "What are you doing? You look great." He said, "I got the pellet." I said, "The pellet? What's that?" And so I did research, found out about it. I trained for 3 years to learn how to do it. And then once I did, I've done thousands of these procedures, and it is available for men and women. Men and women. And I really like to do partners, because if I do one person in the relationship, it will hypersexualize them. So they'll want to do it all the time. They will need to do it all the time. And if the other partner is not with the program, it creates a rift in the relationship. So I like to do husbands and wives, long-term boyfriend, girlfriends, or whatever the nature of your relationship, to do that. But sometimes, women say, "My husband, he won't do it. I can't get him in. So I want it." And so they'll get it. And it is literally the greatest thing going. Things like hair growth, or preventing loss of hair, all kinds of great things. Google BHRT, bioidentical hormone replacement therapy. And if you're in or around the city of Atlanta, Dr. Collier performs that procedure and would be happy to perform it for you. That is not a problem. It is something that is great. So, but again, Tawanda, you don't ever have to stop BHRT. There's no contraindication to it. Once you have a dose that has been diagnosed and given to you that works for you, the dose never changes your entire life. So you can do routine blood work to monitor certain things, and your insurance will cover that. However, the insurance will not cover the bioidentical hormone replacement therapy. So that will be out-of-pocket expense. But once you have had it, you become Superman or Supergirl. And once you have become Superman or Supergirl, you don't want to be Clark Kent or Kala, the female version. Okay, very good. Thank you, Tawanda. And Kennedy, I'm having some pain in the back of my neck and shoulder. I'm not sure if I slept wrong or what. Someone suggested I see a PCP for a Medrol dose pack or get cortisol injections. Thoughts? I oftentimes will use a steroid injection called Depomedrol, and I call it, and I'll say Decadron is the trade name. Decadron, 1 milligram and 1 milligram. One is aqueous or water-based that gives you an immediate high level. The other component is oil-based. It's slowly delivered over a period of time. It is just like the Medrol dose pack, except you don't have to take all of those pills. The Medrol dose pack is a steroid pack, usually in a 4 milligram dose. Starts off with 7 pills the first day, 6, 5, 4, 3, 2, 1, until it's done. It provides amazing relief from inflammation, which is the primary problem in most disease states, particularly musculoskeletal, neck and shoulder. It will break down that inflammation and just give you pain relief. And of course, a non-sedating anti-inflammatory and a non-sedating muscle relaxant will also and should be part of that therapy. You also might benefit from getting to know your friendly neighborhood chiropractor. This is exactly what they do, and they do it quite well. Adjusting is oftentimes a great benefit, but Dr. Collier always gives my patients, I always provide my patients a muscle relaxant and anti-inflammatory and referral, because you'll go to the chiropractor and get great relief, but 6 hours to 8 hours later, you're starting to hurt again because those muscles that he so diligently, or she so diligently loosened up, now are spasming up again. So the anti-inflammatory and the muscle relaxant stops that from happening. So I will say a chiropractic, which is basically physical therapy, and adjusting. There's a few other things with chiropractic, but all physical therapy, which loosens the muscles up and allows somebody to just, lay of hands and loosen those muscles up. Therapeutic massage, any or all of those entities will help. the anti-inflammatory and the muscle relaxant are key. And then to break up acute inflammation, I will oftentimes use either a Decadron injection or a Medrol dose pack. The great thing about the Decadron, you get it one time, you're done. You don't have to keep taking pills for 7 days. It is very difficult to do that. More importantly, particularly if you're on other medications. If you're on 4 or 5 other drugs, then you have that problem. So there we go. Okay. So I see in the thread there, I see Don Alexander. I have hypothyroidism. I heard recently levothyroxine can be damaging long-term. Thoughts, please. If you have hypothyroidism, you need thyroid replacement. No ifs, ands, or buts. The thing is, levothyroxine, which is the #1 most prescribed thyroid replacement in the United States, it's not the best thyroid hormone replacement. It is synthetic. It is made of T4, which is inactive thyroid, that has to be converted to T3, which is active thyroid hormone. And some people do that very well. Some people do it okay, but they do it. Other people don't do it efficiently at all. And so they're taking T4, which is inactive thyroid, and doesn't help you at all when you need T3. There are T3 products and combination T4 and T3 products that can be taken. There's Nuthroid, there's Armor Thyroid, there's a Nature Thyroid. There's so many different thyroid hormone replacement therapies that are so much better than levothyroxine, but most doctors, unfortunately, including endocrinologists, don't know about them and or don't use them. So ask about an alternative to the levothyroxine, and I guarantee you will feel better, look better. The other issue with thyroid disease is this. There's a range of normal for thyroid, and if this is low, let me see if I can get it from you. This is low and this is high. You don't want to be here, right by the low side. You want to be here by the high side, or somewhere, in worst case scenario, in the middle, right here. Optimally, you want to be on the high side of normal so that you push that envelope. Unfortunately, a lot of doctors, when you have hypothyroidism, you're outside of my hands. And doctors, as soon as they get you inside of my hands, they stop. They don't increase the dose. And you really need to pump the dose up to the highest maximum tolerated dose to get the best benefit. Great question, Don. We see it. Okay. Torondo's Howard. What is the cause of my hands peeling, the palm of my hands, and what can I take to prevent it? Is there some type of vitamin I can take? That is an inflammatory and allergic response. Most of the time, it is due to a contact dermatitis. In other words, something that your hands are being exposed to or putting your hands in. Or you do that and then you wash your hands with a product. And most soaps or solicities, they can aggravate the skin. Saponification, the process of making soap, and saponification, which is what soap does when you wash your body and hands with them. We wash our hands continuously. Well, we wash our bodies. Most people once a day, sometimes twice a day. Some people do it less than that, unfortunately. But you may wash your hands all day, every time you use the toilet, every time you do something. So that skin, at minimum, can become dried out. And so you need to immediately put a moisturizing on that skin to form a barrier so that water cannot get under there and cause that skin to crack. And so, there are multiple products that can do that. Fortunately, some of the things that people have used, like Vaseline, are the worst thing you can do to put on those. So vitamin D at 5,000 international units per day is great for skin and inflammation. Vitamin E is the ideal product. You can take it orally and or topically or both. Get a lotion with vitamin E. I like to use Suave brand, Suave. Is inexpensive and it feels like silk. It is a great product, and you can get Suave with vitamin E in it for skin health. And so the problem is you got to get a small tube to carry around so that when you wash your hands, you can apply that, and that will prevent the peeling of the palms. There are some other, autoimmune problems that could be the case, but again, that would be uncommon, and we're talking about things that happen commonly. I think if it was an autoimmune problem, you probably would have had a severe enough complaint that you would have seen the doctor by now about that. So if it's basically just dry peeling of the skin, then this is a usual thing. What I just prescribed and discussed with you would be appropriate therapies. All right. Jenny Hampton, age 60. I walk 6 hours a day. The weight does not come off like it did when I was younger. Well, welcome to my world, Jenny Hampton. The weight does not come off like it was when I was younger. Is there a person on this thread or on this right now who doesn't relate to that that the weight doesn't come off like it did when I was young. Remember when you said, I got a party I'm going to on Saturday and it's Monday, and you said, I need to lose 5 pounds by the weekend so I could be looking my best. This is men and women. Easier in men, but women oftentimes did. You could drink an extra glass of water a day and lose that weight just like that. And it will be gone. It will be permanently gone. It didn't come back on Monday. We're talking about real comprehensive weight loss. But guess what? As you age, your metabolism changes and your body starts to store food as fat instead of letting the food and the fat go through you. Now, it's more difficult to burn those calories. And you, as you stated, walking 6 hours a day makes no difference. You cannot exercise away fat. You exercise to get fit. You lose weight in the kitchen. So monitoring and making sure that your calorie intake is matching your caloric requirements. But then you want to change your metabolism so your body isn't storing food as fat. 2 things. 1, our Lipodrops. This is exactly what the Lipodrops maximum strength formulation does. 1 drop of fluid under your tongue. It is absorbed. This product was originally an injectable. And the problem is you got to go to the doctor to get the injection. Now, there's some places that will give you a bottle of needles and say, go home and give yourself a shot. Dr. Collier never does that. I always make sure if you're in my weight loss program, you have to come to my office and receive the injection so that we know, 1, you're getting the right amount and that there's no problem with injection. There are problems with injections when administered inappropriately. So we do that. Now, but because of that inconvenience, people say, what can we do? We made a sublingual formulation that you put under your tongue, which is just as efficient, if not more so, than taking an IM sub-Q injection. So when you do that, we want to make sure that there's no problem with that. So the Lipodrops maximum strength, a product you can get on our website, lipodrops.com. You also probably would benefit from our Lipo Nights. This is a product, 2 capsules you take in the evening, and it literally makes you burn fat at night while you sleep. It has 3 different fat burners in addition to melatonin. Why melatonin? The melatonin is very important because it makes sure that you get a good night's sleep. When you sleep well, deep restorative sleep where you're dreaming, you don't have the production of cortisol, that stress hormone that makes fat immediately go to your abdomen and gives you the fat stomach syndrome. And the problem too with that is that the fat is not just under the skin, it's inside around your organs and makes you bulge out from the inside. So the Lipo Nights and the combination of the Lipo Nights with the Lipodrops maximum strength will give you exactly what you're trying to do. And again, without necessarily changing your diet, it just makes you metabolize the foods that you're eating much more efficiently. So go to the website, lipodrops.com, Jenny. Look up the products. It will explain to you, or it will ask you a few questions, and then it will explain to you what you need to do to optimize your weight loss. Okay, great question. Okay, I'm looking at Miss Tiny Tiny. If the person is diagnosed with stage 2 kidney disease, should they be referred to a nephrologist? Not necessarily. If your primary care doctor, which can be a family physician or internist, is comfortable treating that, stage 2 is not bad. And the problem is usually just a matter of taking care of the primary disease state that is causing you to have kidney disease. So kidney disease, or CKD, chronic kidney disease, comes in stages 1 through 5. 2 is basically first stage really of having kidney disease. And so most often caused by either uncontrolled high blood pressure or diabetes. The kidneys and the liver are 2 organs that have the innate ability to regenerate and repair themselves. No other organ in your body can do that. They will, like say, if you have a heart attack, it just scars down and starts to get better function, but it does not repair itself. The kidneys can regenerate. The liver can regenerate, which is why people can donate a portion of their liver to someone and then within 6 months to a year, that the liver is grown back and it's back the same size that it was before. So that's the good thing about it. At stage 2, your kidneys can regenerate themselves. No ifs, ands, or buts. But the primary therapy is controlling the disease states that are causing the kidney disease. Also, and this is key and very important, because people always ask, what can I do naturally? What you can do naturally is make sure that you're drinking 8 to 10 glasses of water every day. The primary problem was this: stage 2 kidney disease is like having an engine with low oil. So you got low oil in the engine, but it's just before the check engine light comes on. So it's used to it. The car is driving, the engine cranks up. It may ride a little rough, it may not. But damage is being done to the engine because the oil level is not optimal, and so you're having that problem. Now, by the time it gets to the point where the check engine light comes on, you're at stage 3 of this chronic kidney disease. And then stage 3 has stage 3A and 3B. So all of those issues are things that you control, that drinking the water will optimize your glomerular filtration rate, which is exactly what it sounds like. The rate at which your kidneys filter your blood, which is what the kidneys do, removing toxins and removing other things that you need to come out as waste products or in your urine. So including sugar from the diabetes. So you want to make sure that you're optimizing your glomerular filtration rate by drinking enough water. And guess what? There is no substitute for water. This is in addition to anything else you're drinking. And so one of the simple ways to do this is when you're drinking something other than water, Coke, iced tea, Sprite, Jack Daniels, beer, whatever it is, you also get a glass of water. You get a Coke, you ask for a glass of water. If you finish the Coke, you finish the glass of water. If you get a refill on the Coke, you get a refill on the glass of water, and make sure that you completely drink that glass of water. That simple change in your lifestyle will make a major difference and virtually assure that you're getting enough water in, which will dramatically improve your glomerular filtration rate, which is how you make the diagnosis of chronic kidney disease at various stages. Great question. All right, Heidi. Sean Big Time Green. I see these ads about pumpkin seed oil being good for your kidneys. What are your thoughts? Not familiar with the mechanism of action as to why they would be good for your kidneys. So not something I would endorse in any circumstance. The soliloquy that I just gave about drinking water is the best thing that you can do for your kidney health. Keep those kidneys working. And one thing about it, you particularly when you first start drinking 8 to 10 glasses of water per day, you're going to be urinating more frequently. Now, eventually your body will adapt to that and it won't be happening. But if it does, you just have to urinate more often. That's just the key. So the biggest problem is that as we age or become more busy with our work or what our to-do list is, we drink less water. But one, because we just don't have it available. And two, because we don't want to have to stop doing whatever we are doing to go to the bathroom and urinate. So that is something you have to be conscientiously aware of. Particularly when individuals start to have problems with incontinence, if they start to leak or they don't think they're going to get to the bathroom in time, they spontaneously start to restrict their fluid intake. If you're having to get up more than once or twice in the middle of the night to urinate, people spontaneously restrict their fluid intake. And what happens is they ultimately give themselves a chronic kidney disease stage 2 or 3. So drink more water. There we go, Sean. Jackie Williams, can a 70-year-old take lipo-hers? Absolutely. A 70-year-old, a 17-year-old. No, if you are 70 years old and want to take something that's going to enhance your sexuality, then without question, that is the product for you. One, it is natural. Two, it is compatible with any disease state. So if you have high blood pressure, diabetes, high cholesterol, doesn't matter. You can still take the lipo-hers. You are menopausal, so you need something to, I guess you could say, oil the gears to get things going again. The great thing about that product is it will increase the sensitivity of your perineal area and your clitoris so that you're more easily stimulated, which will make your vagina more wet. And again, you also it will enhance the intensity of your orgasm. So if your typical orgasm was 10 when you were in your 20s, and then every year it comes down, and now it's maybe a 5, you'll be back up to 10 in no time. So one of those things you want to do is do this. So the answer to your question is, Jackie Williams, the lipo-hers, and after you've been taking it, probably the first bottle, the second bottle is when you're really going to feel like it's the fountain of youth. The first bottle is kind of taking you out of the hole in the deficit that you're in. So if this is your baseline and you're down here, you got to come up to here. Then you got to exceed that to get more benefit. So we got to fill that hole in the deficit. And, other questions as in, your level of sexual activity now. Are you having and enjoying intercourse at this point, or has it been a while? So all those things are things to take into consideration. But remember, the product, if it's been a while, start slow, go low. This is not the time to relive every fantasy in your first encounter, but you will definitely benefit from taking a product like this, the lipoherpes. Great question, Jackie. Dr. C, I'm up to 5,000 international units of vitamin D and feel great. I've also noticed that my gray hair is darkening, specifically since starting to increase. Could this be a wonderful benefit? Val D, I hope that is a wonderful benefit. One of the things that causes gray hair is inflammation of the hair follicle, and so it does not make color, and so gray hair grows out. Hair that is darker in color does not change to gray. Gray hair grows out, it grows from the roots. So if you're decreasing the inflammation, which is vitamin D, the body's natural anti-inflammatory, but it also, when your vitamin D level, a normal range is 30 to 90. When your vitamin D level is less than 40, you have weak bones, you have weak teeth, you have poor skin and hair health, and you have poor immune system function. So if you take the vitamin D, you get strong bones, you get strong teeth, you get strong skin and hair. So all of those things are things that benefit that now that you're asking the question, I can answer it eloquently, but not something that I promoted it for. So I'm glad that you're getting those great benefits. Vitamin D is God's gift. The problem is that most doctors don't even recommend that you take it. Those that do underdose it tremendously, and because the most commonly available over-the-counter dose is 1,000 milligrams, international units rather, 1,000 international units, and that is just not enough. Even taking 2 of them, people say, well, I take 2, that's not enough. So you could take 4 of them, but that's 4 capsules that you need to take, and that's a large pill burden, and most people wouldn't do it. So my doctor's D is 5,000 international units of pure vitamin D. It's a small capsule, easy to take, and changes your life. Dr. Collier takes it every day, and it is one of those things that I call my essential trio, 3 things that you should take every day to optimize your health. The vitamin D at 5,000 international units per day, probiotics, 2 capsules a day, and omega-3 fish oil. Those 3 things, no matter what your age, no matter whether you're male, no matter whether you're female, no matter whether you have 5 disease states or whether you have no disease states, Dr. Collier's essential trio will be life-changing for you, perfectly safe, and always something that you would do. And doctor, if you've seen my video, you see what my regimen is. In the morning, I take 1, I wash my face, I take a pill. I shave, I take a pill with a full glass of water, so that there's time between each dose, each one with a full glass of water, and that allows the pill to be dissolved and get out of my stomach and into my system. So great question, Bal D. We appreciate you. I see in the thread, Carrie B, Dr. Collier, I listen every Wednesday. I was told that I have high cholesterol. A doctor gave me rosuvastatin, 20 milligrams. My ankles get swollen. Why? It's very embarrassing. I have to wear pants. I am 61. The rosuvastatin has nothing to do with your ankle swelling. Your ankles are swelling because you either retain the fluids or you have problems with venous circulation. And so very important there. A simple thing is to diurese. If you're wearing pants, you wear support socks that come all the way up to your, what are called over the calf socks. They basically come up to your knees, the knee-high socks, not compression socks. When this is not a compression sock issue. Compression socks will fix the problem, but they're hard to get on and they're very hard to get off. So the problem with compression socks, and they're ugly beige color that doesn't go with anything. But over the calf support socks, and if you have to buy men's versions, that's perfectly okay. There's no difference in them except men's are less expensive and last longer than women's do. And they're also more readily available. But you can find them on Amazon. Not a problem. That will help with that. Okay. Linda, how can I poop regularly instead of every 4 days? 2 things. 1, probiotics will help change the gut flora and optimize your GI health. And 2, we have a product called Lipo Cleanse. Lipo Cleanse is not a laxative. It is not a laxative, but what it is, it contains fiber and a few other things that help you have large, easy to pass, regular bowel movements. At minimum, it should cut that in half every 2 days, but optimally, you'll be having a regular bowel movement every day, particularly if you add crunchy fruits and vegetables. If it crunches when you eat it, it's good for your digestion and your GI system. If you're only pooping every 4 days, your GI tract is full, and it's very difficult to move beyond full. So what I recommend is you take a laxative or a real cleanse, a laxative type cleanse, to empty your colon. I tell people to go to the store where everything's $1.25 now, and there's a product called Senna, Senna. They got a whole section with laxatives and things for your stomach and all that. It's got maybe 16 tablets in a box for $1.25. You can take 1 to 4 tablets. I found that 2 is optimal for me, and cleans you out the entire GI tract. Without you take it at night, you'll have a decent bowel movement in the morning without having to rush or have uncontrolled diarrhea. Now, if you take 4 of them, that's what's going to happen. But 2 in a tiny little pills, you're just not going to think that's enough. But 2 will probably do it. But if you need to, take a Friday evening or a Saturday when you have time, you're off work, so that you can have so that you can take the medicine and wait for it to work, and so it cleans you out there. Then once that has happened, you start taking the lipo cleanse. You add crunchy fruits and vegetables to your diet. Everybody has that food that they can eat, and it's going to make them go. It may be cabbage, it may be spinach, it may be grapes, it may be prunes. Whatever that food is, eat more of it and make that a regular part of your diet. So the lipo cleanse, the probiotics, crunchy fruits and vegetables, clean yourself out first. And then, because you're going to have to retrain your GI tract, it's used to holding 4 days worth of poop in it. And so that means it's probably dilated a little bit and making your stomach bulge out. So this is going to help flatten your stomach as well. And so the probiotics and or the Greek style yogurt every day, that will be good as well to help with that. But crunchy fruits and vegetables, the natural way to do that. Okay. I see on here from Arthwan Lewis, what do you recommend for treatment to cure and prevent toenail fungus and darkening the toenails? 1, prescription medications are readily available. There is nothing you can paint your toenails in, soak your toenails in. It's going to normalize this condition, because the fungus grows from the root, and that is under the skin and in the, that's why medications that's in your bloodstream work best. So when you see these advertisements for things, I did this, I saw something on the internet recently. I started using this, and 3 days later, my nails were normal. That is impossible. It cannot happen, because no product exists that converts a fungoid nail to a normal nail. The nail tissue is dead. It is being replaced by fungus. That is why the toenail turns yellow and flaky and rises up from the nail bed. That's called oncolysis. That's when the nail separates from the nail bed, and that's all fungus there. Nothing changes that to normal tissue. It has to, you put an antifungal barrier by taking an antifungal tablet that works from the inside out, and will also set up an antifungal barrier from your feet to your scalp, top of your head, bottom to the top. That is great from the perspective of if you have any other fungal infections, including things like seborrheic dermatitis or dandruff, skin rashes like tata, as they call it, or those bright white spots, tinea corporis. All of those will respond to an oral antifungal that is usually safe to take, and no problem. You can take it for as little as 14 days or as long as 3 months if you have really bad nails. 3 months is the standard length of time for therapy. New nail has to grow out from the nail bed, so the new nail will grow from here and grow forward. And so after a few weeks, you will see a clear area look like a half moon. Then maybe you'll have half fungoid nail and half normal nail, and it will grow out eventually so that your entire nail is normal. Now, the question becomes, how long does that take, Dr. Collier? Depends on your nail growth rate. Some people's nails grow 1 to 2 millimeters a month. Others grow 5 to 8 millimeters a month. So if your nails grow fast, it will happen quicker. If your nails grow slow, it will take longer. The problem is, too, when we get bad nails, we want to cover our feet up, so we keep our toes in shoes, and it's jamming up and slowing the growth rate of the nail. So if the nail is free, a sandal type shoe where the nail can just grow normally, you will get a quicker response. But soaking your foot and putting lemon juice and all these things in there you see on the internet will not convert a fungal nail to a normal nail. The process cannot and does not happen. I have seen doctors prescribe, there are some prescription medications that paint on like nail polish. Again, they do not convert normal nail, a fungal nail, to normal nail. Say it with me, everybody. No conversion of pathology to normality. It does not and cannot happen. It is impossible. So very important that you take those natural steps. This may be an opportunity to see your friendly neighborhood podiatrist. This is what they specialize in. But most doctors can treat it and will if you ask them to. You just have to make sure you take your shoes off when you go to the doctor's office and let them evaluate you. But podiatrists, this is all they do. And if they really, they're really elevated and just thick, then they have special tools. They can grind that down and give you a better cosmetic look on day one. But that doesn't fix the problem. It just makes it look better, because people can put these covers on the nails now. And I just realized people are doing this on their toenails. The same cover nails that you have on your fingertips, the tips, you can put on your toes. And so people that really have fungoid toes that don't look good will put those covers on them. Doesn't fix the problem, just gives them a better cosmetic look. So to prevent that from happening, you want to make sure that is indeed not an issue. So podiatrist, primary care physician, family physician, Dr. Collier, happy to see you for that. But again, this is a problem to fix and cure will require a doctor's visit and a prescription medication, preferably an oral tablet that you take anywhere from 2 weeks to 3 months that will fix this. And I tell you, the time comes and goes very quickly, particularly when you got bad looking nails and all of a sudden now your feet are flawless and you proudly wear sandals on your next trip to the Bahamas or the DR. Okay, great question. Will vitamin E help the nails grow faster? Antoine Lewis. Yes, vitamin E is a great supplement for nail growth. Vitamin D as well. So you can take either or both. But vitamins, a complete multiple vitamin with iron and minerals should be a part of that for overall nail health. You don't just want your nails to grow fast. You want them to grow firm so they're not chipping, cutting, breaking. You're not getting hangnails. So for women, 1 a day for women, for men, 1 a day for men, or the generic equivalent. There's no such entity as a premium vitamin. A vitamin is a fixed chemical formula. There's no better way to make it. So if you see 1 a day for women or Centrum or Z-Bay on the shelf and right next to it, compared to 1 a day for women, you buy the less expensive product, it is exactly the same. Now, if you're spending more than $15 for a bottle of 100 vitamins, you are paying for a very pretty bottle or a celebrity endorsement. Either one. You should be able to get 100 vitamins for under $15 and sometimes less than that. Just make sure that your label says a complete multiple vitamin with iron and minerals. Then you can add that. You cannot get in a complete vitamin. You can't get enough vitamin E to make a difference. You can't get enough vitamin D to make a difference. So you will I would continue to recommend the vitamin D at 5,000 international units per day and vitamin E supplementation up to 1,000. Okay, great question. April Striggers, what do you recommend for women's hair growth? You talk about it on the Rickey Smiley Morning Show. Once again, hair growth is one component. Preventing hair loss is another. The most common causes of hair loss are anemia, 1, thyroid disease, number 2. The hair is one of the highest metabolic rate things that you have. Your organs is one of the highest metabolic rates, which is why cancer is a high metabolic rate condition. So when you get chemotherapy, that is why you lose your hair, because the hair sucks up the chemotherapy just as the cancer does because of its high metabolic rate. And that is basically an indicator that the chemotherapy is working in your body. So you may lose just the hair on your head. You may lose your eyebrows. You may lose your eyelashes. You can lose every hair on your body. And some people don't, but that usually is an indication that the chemotherapy is not working as well as you like. Sometimes it's just a blessing. You don't lose your hair for whatever reason, and you still have successful chemotherapy. Now, preventing that, you check your first thing I do is check blood levels for anemia. Recommend a complete multiple vitamin with iron and minerals, and then check for thyroid disease. If they have thyroid disease, optimize, get them in the range of normal, and then push to the high side of normal, as we stated. That will optimize sustaining hair and hair growth. Then supplements that can help. Again, vitamin E is excellent for that. Again, but basic nutrition, making sure that you're not living on fast food and you have some good things that will help growth because of its high metabolic rate. It needs fuel to grow. And so you can't fuel it with fast food chicken and fried chicken or burgers. You got to have, an entree, 4 to 6 ounces with meat and vegetables. You got to have some good foods in there in addition to the vitamins. So, but also things that can secondarily affect your hair, like stress, You black in America, you're catching hell every day. You constantly under stress. Women have to take care of their children, have to take care of their husband, have to take care of the household. So most women have 3 jobs and they do them quite well, but it is a hell of a toll on the body, and that stress shows on them, and it may result in hair loss as well. Not counting anything else that can cause or stress you out. So those are the things you got to be concerned about, your emotional status as well. Great question. Takana Jones, why would your B12 elevate to 2,000? What can you do to get down or keep it low? Something that you're taking. Your B12 cannot spontaneously go to 2,000. That is, I'm not sure whether that will even harm you if it does go up to 2,000, whether that's a bad thing. It's above, I think the range is about 1,000. So going to 2,000, but that has to be something that you're taking that has B12 in it. I just don't think you can eat enough foods with that. It's got to be something, some kind of supplement that's got the B12 in it, because there's just no natural way to do that. Your body does not manufacture B12. It has to come from exogenous sources. It does not store B12 or any other vitamin. It takes what it needs, and everything else comes out in waste, in urine and feces. So having elevated B12 like that, to get it that high, I'm thinking injections, but it also could be something else. And it may not even be something that you're aware of. You may be taking another supplement, and then we go and it's something else. So we don't know. Okay, great question. Do Lipodrops help with vaginal dryness? Not directly. Weight loss helps with vaginal dryness. And so if you lose weight, all of the energy and effort that your body is doing to support extra lipocytes or fat cells is gone now. So that is available to sustain your body's normal homeostasis. So that includes vaginal dryness. It also changes when you lose weight, your hormonal status. So hormones that are necessary to keep the vagina stimulated, particularly estrogen, will help with that. And as you lose weight, your estrogen level concurrently goes up because it's less body to support. So it's less to do that. So secondarily, yes, but wouldn't be my first choice. If I have vaginal dryness, then I would go with the Lipo HERS, which will help with vaginal dryness. And then if you are 40 years or older, the doctor's menopausal support, which is our newest product, which will help with that tremendously. So those two things can do it as well. So if you need to lose weight, that's what the Lipo Drops primary function are. They alter your metabolism, make your body metabolize food instead of storing food as fat. But the Lipo HERS stimulates you physically, enhances the intensity of your orgasms, makes you, makes them go from 5 to 10 plus, and makes your vagina thick and wet. That is what it does. So that will help tremendously with that. But if it's also menopausal symptoms with hot flashes and all the other problems of perimenopause and menopause, then the doctor's menopausal support will naturally relieve those symptoms as well. So Nicole, great question. Go to the website, lipodrops.com, and look for those products, the Lipo HERS and the doctor's menopausal support. Those two things will be life-changing for you. Jennifer White, I'm hearing a lot about collagen intake. Do you have any recommendations? Collagen is the building blocks for tissues. It is the scaffolding that your skin grows around. It connects and forms tendons and other parts of your body. So collagen is great. It's a significant and substantial portion of your nail bed and nail health. Fingernails I'm talking about, and toenails. So collagen intake is good. Don't have a product. There's no better way to make collagen. So if you find that collagen comes in liquids, it comes in capsules, it comes in cans like soda. There are various ways to get it. It works best if taken in conjunction with something like vitamin D. Just helps build that matrix and helps it absorb better, etc. But collagen is something that we all need. It's the building blocks. It's like when you build a house with bricks, you need the cement. That is what collagen does. And so it helps with things like sagging eyes and baseline for your skin. If your skin is starting to sag or get wrinkly or crepe-like. When I was at the airport yesterday, the lady on the escalator in front of me, she was standing there. She looked fine. She put one leg one step higher on the escalator. Her entire leg turned to crepe. I was like, wow, I had never seen it so dramatic before. But that was that. I don't know whether she had lost a significant amount of weight. She probably had. but that was the most dramatic presentation of loose, crepey skin that I have seen. She would benefit from collagen, as do we all. So no name brands from the collagen, but any product that has and tells you how to take it in recommendation wise. Okay, great question. Shaquille Mims, can you please give me some tips on having Achilles tendonitis? I woke up one morning last week and back of my heel was hurting and haven't went away. And it's not going to go away. It's probably a shoe that's irritating the back of the tendon. That's the Achilles tendon that connects the heel to the calf muscle to hold and make your foot plant when you're taking that first step. So that is inflamed, and what you don't want is for that to rupture. Now, it will probably take, it's very strong. It's very strong. It would probably take some substantive or significant trauma to make it rupture, but it could rupture, particularly if it got infected. So it's important that you, prevent anything from rubbing on it. So open back shoes or shoes that are above the Achilles tendon, the back of the shoe. So the shoes that usually have the little finger loop for you to pull them up, they usually have higher backs on them. Skechers are very good for that. There are some name brand tennis shoes that might aggravate it, but it's definitely directly connected to a shoe that's rubbing. It could be a dress shoe that's rubbing the back of that heel. You got to make sure that one, if that's the case, that shoe is never going to be better. You can't make it work. You need to change that shoe, give it away, give it to your friends, donate it to somebody. But that shoe is not going to work for you because it's just the way that it is cut and made. You probably know exactly which shoe I'm talking about. Okay, that was the final question. That brings to an end this episode of the Ask Dr. MJ. Why? Because your health is important. Radio, YouTube, broadcast on all social media. We want to make sure that you join us again in 2 weeks where we're going to have a special edition of Sex in the 50. Sex in the 50. So if you are younger than 50, if you're older than 50, these are basically discussions for grown folk to talk about their sexuality, things they can do to enhance their sexuality, things we can do to boost your self-esteem, things we can do that will make you feel better about being sexually active. If you have had an extended period of time of abstinence, you have not had sex, we want to make sure we talk about that. If you're compromised in some way, then we want to talk about that. We were talking about, we had a couple of questions earlier about men with ED and all the problems that they have. So there are physical problems, there are medical problems that men and women can have. And so you have to be a sensitive and understanding partner. And there are workarounds that we're going to bring to you to talk about things like if you have bad arthritis in the hips and you can't put your legs up, how do you enjoy sex? All kinds of things and questions we're going to talk about. Sex in the 50 next week. You want to tune in in 2 weeks. 2 weeks on Why? Because your health is important. Ask Dr. MJ live on YouTube, Instagram, and Facebook. And also go to the Lipodrops website, lipodrops.com, the official website where you will see my picture and you'll get lots of information. There are pirated sites out there. If you Google Dr. Collier, it will take you to a pirated site. And then people will call me and say, I ordered product, I didn't get product or whatever. It has to be the official Lipodrops website where you see my picture and you'll know that you're on the right side. Dr. MJ Collier signing off. So good to talk to you. We'll see you next time. Remember, Sex in the 50 at our next broadcast. Tell your friends.